Anatomy of the scalenes coming right up. The scalenes are the deepest muscles in the neck, and they're stabilizers of the cervical spine. So they can get out of whack with a host of things. Even sneezing, even coughing can cause tension in the scalenes. The scalenes muscles will always feel kind of hard and thick. They should never feel really soft because they're holding up the cervical spine. So I made this class. This is a continuing education class that I've taught for many years. It's available online too, really inexpensive, just a couple of CEs for you, and you get this anatomy teaching. This video that you're about to watch is actually the anatomy teaching from that CE class, and super valuable to really understand all different types of things that cause tension and problems in the scalenes. Because when the scalenes get really jacked up, you could have one side gets more tense than the other. That can cause slit discs, herniated discs. Both sides of the scalenes can really compress and lead to degenerative disc disorders. They can lead to numbness and tingling as they cut off the nerve supply through the brachial plexus. We're about to talk about a lot of that stuff, but just to understand that really knowing how to work well in the scalenes is one of the best tools in your toolbox, because every single human needs scalenes work. So here's anatomy of the scalenes. I hope you enjoy. Hi, welcome to Module 1 of the Scalenes class. I'm so excited to share this information with you because you're going to be able to help a lot of people with their pain once you have understanding of the scalenes and what the tension feels like in the scalenes, what kinds of symptoms your clients will have if they have scalenes tension. In this first module, we're going to start with going over the anatomy of the scalenes. We're going to talk about different symptoms of the scalenes tension, and then how that tension actually builds in the scalenes muscles. So let's jump right in. We have a lot to cover. The scalenes muscles, there are 3 on each side of the neck. So here in the picture you can see there's the anterior scalenes running along the front of the cervical spine, the middle scalenes or scalenus medius, just a little bit more lateral on the neck, and then the posterior scalenes toward the back of the neck. So these muscles surround very close in. They're the deepest neck muscles here along the cervical spine. So they're stabilizers. They stabilize the cervical spine. That's one of their jobs. So with these 3 pairs of scalenes, they create lateral flexion, or tilting the head from one side or the other. They do a little bit of contralateral rotation, which means that it turns the head to the opposite side. So when my right side scalenes contract, it's going to turn my head just a little bit to the left. And the anterior scalenes also contribute to flexion of the neck. And that's kind of a big deal, especially now that so many people are texting, or we're looking down on laptops, working on smaller and smaller devices. We have more and more forward flexion of the neck, which can cause that anterior scalene muscle to get really short and tight and fraught with tension. All of the scalenes muscles originate on the transverse processes of the cervical vertebra, and they attach on a rib. So rib 1 and 2 are our attachment points for scalenes muscles. The anterior scalenes go from the transverse processes of C3 to C6, and they insert on the first rib. So anterior scalenes C3 to C6, and insert on the first rib. Hey, quick pause in this video. Cat Matlock here at Free Body. I'm so glad you're here. And I just want to point out a couple of things. Down in the description of this video is a link to my online classes for continuing education credits. I'm nationally certified NCBTMB, so most states will accept those classes as continuing education. Also, go ahead and subscribe and like this video. Put a comment down if you learned anything from this video, or if you have a question about any of the information, I do look at comments and I do answer questions. The middle scalenes, and I like this picture from Gray's Anatomy because it shows you how directly related. Here's middle scalenes highlighted in this picture, and then right next to it, right in front of it, is the anterior scalenes. The middle scalenes go from C2 to C7, and they insert on the first rib. C2 to C7, and insert on the first rib. And so here we see anterior scalenes. Here's the first rib. They're coming down, attaching on this rib here, and then right behind them, middle scalenes attaching also on that first rib. Now the posterior scalenes is a smaller muscle. It goes from the transverse processes of C5 to C7, so really low down toward the bottom of the cervical spine, and it attaches onto the second rib. So it's an almost horizontal muscle. It just goes from C5 to C7 and then attaching down on the second rib. This muscle, in my experience, always feels really hard and stuck, almost like a bone, almost like it's pretending to be a bone and forgot that it's soft tissue. So that posterior scalenes can really hold a lot of tension. So anterior scalenes, middle scalenes, both attaching to the first rib, posterior scalenes attaching to the second rib. These muscles, again, will create tilting the head or lateral flexion, some contralateral rotation. Another big job of these muscles is that they stabilize the cervical spine. So if there's an accident or a head blow, these muscles will all contract together to try to hold the neck steady so that there's not injury and damage to the cervical spine. So these muscles are going to get caught up with a lot of tension, or can get kind of stuck holding tension after a car accident, after a fall, after a slip, when there's just a little like whoo, like that. So all kinds of ways that the scalenes can get fraught with tension. And we're going to talk more about that a little later in this presentation. So here we have a beautiful picture from the Travell and Simons Myofascial Pain and Dysfunction manuals, the Trigger Point Therapy Bibles. We can see that the relationship between the scalenes and the brachial plexus is quite an intimate relationship. We can see here in this picture, we have the anterior or the front scalenes, and then we have the middle scalenes just lateral and posterior to them. But what we see in between is the brachial plexus and the blood supply that goes along here. So we have the subclavian vein, we have the brachial plexus, and then we see the nerves riding along that vein. And so we can see that the anterior and the middle scalenes are deeply connected to this nerve bundle. Plexus is a bundle of nerves, and the brachial plexus just means that it's in this area. Okay, so it passes between the scalenes, dives under the clavicle, under the collarbone, and then even dives under the pec minor muscle at its upper attachment at the coracoid process. So it's very beneficial to open and release the pectorals when you want to do some work on the scalenes. Okay, so here's another picture, scalenes and brachial plexus. Here we have anterior scalenes, and I like this picture because the anterior scalenes are kind of almost straight up and down. And you can really see that here. You can see this beautiful, here's middle scalenes right here, brachial plexus, subclavian artery, following along here. The clavicle has been cut and portion of it removed in this drawing, in this rendition. Here pec minor has been cut and reflected. Here's the other portion of the pec minor. And so you can see pec minor also covers the brachial plexus and the subclavian artery. So anterior scalenes, middle scalenes, brachial plexus, and subclavian artery. So that's the end of the first anatomy portion of this module. So we've gone over where the scalenes live, that they attach on the first and second ribs, anterior middle attaching on the first rib, and posterior scalenes attaching on the second rib. Their actions: lateral flexion, little bit of contralateral rotation, and stabilization of the cervical spine. And we talked about the relationship of the scalenes, specifically the anterior middle scalenes, and their relationship to the brachial plexus, which dives between the anterior and middle scalenes. So in the next portion of this module, you will learn about thoracic outlet syndrome and tension in the scalenes and its relationship to thoracic outlet syndrome. So I'll see you in the next one.